There's the AI voice of recording in progress. I'm also going to start summary to help me take notes, so I don't have to do it while advancing slides, because that's always fun. Okay, welcome everyone to the information session for the Cybersecurity Workgroup. I'm really excited. I just got this new hat at the Civitas for Networks for Health conference, which says everything about who I am and also fits the theme because I am very positive about what we're going to do to help healthcare. So this is a super important part of that. So we'll keep, let's see if I can get a slide advancing and we all see the agenda. Yes. Looks like, okay. So we're just going to run through who we are, why we're here, why we're forming a work group, what the timeline looks like, how to get involved, and then any questions you have. So we scheduled this for an hour, probably won't take an hour, but if we have stuff to talk about, like Christian and Mike, maybe you could use the forum. But I'll keep going on this topic right now. So I am Susan Clark with Direct Trust. So you may also, some of you know me on LinkedIn as #HealthITRockstar. It's my other brand. And I will just quickly, for anyone that's on here that's kind of new to Direct Trust, happy to have the full elevator pitch and discussion with you. Please schedule time with me. But in essence, we are, at the core of everything we do is building trust in the exchange of electronic health and social care information. And cybersecurity is just a very important part of that. So that's why we're here today. We also have on the line Scott Stewie, our president, for any questions or color commentary, but he is in transit from state to state right now. So we may not hear from him, but he is here with us. Very excited about this effort as well. And then we have Mike Green, our fabulous chair of this. And Mike, do you want to introduce yourself real quick?
Sure. Hey, everybody. My name is Mike Green. I'm the Chief Information Security Officer at Availity, and I'm also a Direct Trust ENAC Commissioner for the last couple of years.
And for anyone that doesn't know what ENAC is, it's Electronic Health Network Accreditation Commission. I'm getting real proficient at that. So we can also talk about that at length at any time anyone wants to. So that's another area where we exercise our cybersecurity muscles, privacy and security accreditations, and third-party assessments.
I will say every time I have to tell people what ENAC is, I have to look up and to the left and think really hard to remember all the words. Yes.
I always forget commission. But the C is the one I forget. I don't know why, but
so many C words. But when you said up and to the left, all I could think, anyone Seinfeld fans, all I could think was back.
Back and left. To the left.
Back and to the left.
And now we'll go forward on the slides. Okay, so why do we want a work group? Here's all of this. This is what's happening in our world right now, everything with healthcare. Big stuff, cyber attacks like crazy, ransomware attacks. It's crippling hospitals when it happens. The White House is very aware of this, doing a lot with it. Our legislators are doing a lot with it. We're continuing to see more within the environment around our regulators keep adding a little bit more nuggets. We should expect to see more coming out in that world as well. And just real quick, I'll just say that we envision this as a convening place for healthcare industry professionals to collaborate and address timely cybersecurity issues. And then we can talk a little bit more about what that's going to look like. But this is the why. I don't think probably the folks on this call know this. Like, this is not shocking. But this is the time. The time is now to help the industry, to help our providers, to help those less resourced, to bring up the floor of what compliance and cybersecurity protections look like. I don't know, Mike, do you have anything to add on that?
Yeah, I'll just jump in here. I'll say, as we kind of think about, the last 3 years, right? I like to work in, 12, 24, 36 month, sort of thoughts. It has become very obvious, I think, to a lot of us that there is a significant amount of distributed work, distributed behaviors in the ecosystem. So, payers, providers, and then just a variety of organizations in between providing services, pardon me, onshore, offshore, everybody from the, $100 billion business that is providing, some kind of large scale service to, an individual biller sitting at their kitchen table running a home billing and transcription business, right? All of those folks have a hand in this. And that is, as interesting as that is, as distributed as that is, it is also incredibly fragile. And I think, over the last 3 years, we have seen a significant uptick. I know in the telemetry data that we get, I've seen a significant uptick in the number of attacks, the kinds of attacks. And I think over the last year or so, that has made its way into the general public. That's made its way to all the way up to Washington. A lot of states have begun to lean into this. On top of that, we've had a fairly public technology revolution, right, in terms of AI and the democratization. I said it right. Look at that. The democratization of AI. Oh yes, Josh. If I could recommend something to read, I picked that up. A couple days ago. Like, holy fudge! Yes, that is a good report. But quite frankly, we've got two different sort of pressures on the industry. The industry's become very diversified, very fragile, and we've got a lot of new technologies and a lot of we're attracting a lot of bad actors. Right, there is blood in the water. We are attracting more and more bad actors because it is a great place to make quick money, not just from ransomware, but from behind the scenes in interactive financial crimes where you're getting a hold of somebody's EFT transmissions or some of their banking information. So I think now is the time for us to, as a community, I think this is a great opportunity for us to come together and start looking at ways that we can start helping the industry in very rapid succession. So, Susan, I don't know if you want to go to the next slide.
Sure, that's perfect. A little bit more of the why from the direct trust perspective, and I'll start again and let you tag on there that a lot of what direct trust does, again going back to our core, we are a standards body at the heart, at their founding. So we do everything with interoperability standards, and that's you can't send information if it's not secure, or you shouldn't be. And we've actually, because of the merger with ENAC and all of our additions with our accreditation programs that all have a NIST-based privacy security criteria core, we actually have created a new cybersecurity member category for organizations that are provide services around privacy and security, and we're very excited to welcome new organizations that way. And we think all of this brings credibility into the market, and I think a lot of this we hit on, but the bottom bullet, which I think Mike will put a finer point on, what we're excited to do is try to, while all those other things are happening with legislation, with regulation, that's a slow moving wheel. And we want to, advocacy is part of my role, and I will continue to work with all of that to give a voice of whatever comes out of this work group and our other work to influence there. But what we want this work group to do is to come out with some actionable thought leadership and guidance, so that we can bring things into the community, not duplicate with other activities, but be in concert with what HSCC is doing or others. So, and Mike, what would you add on to that?
Yeah, I think to really put a fine point on it, I think we want to work in and this probably leads into the next slide, but I think we want to start working in quarter increments, really tackling, really tackling things that 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 we can break up into, something that we're able to tackle as a group over a 3-month, 6-month time frame, and come out not just with the kind of guidance that larger organizations can adopt, more sophisticated organizations are able to consume and adopt, but real sort of actionable content that your local hospital can adopt, your local hospital complex can adopt, your local provider can adopt, the regional billing company can adopt, all of these players that are, quite frankly, one of the weaker links in the community, right? And one of the more fragile spaces, but to really begin to focus on how do we come up with actionable items in short term, and then start focusing on advocacy at the federal, state, with our industry partners at local levels, beginning to build sort of a rapid iterative model where we can produce some actionable content, some actionable guidance that moves the needle, not looking to solve the entire world of cybersecurity, right? Certainly don't want to try and rewrite NIST 853, right? But something more tangible, something more real, that folks on the ground can take, feel, and address. And I think the interesting thing here is we have some really smart people in direct trust. We have some really smart participants here, some people that are really strong asymmetric thinkers that when we present a problem to them are going to come up with some unique ways of tackling these problems. And I see that as one of the really, really key benefits of bringing this group together and operating the way that we're proposing.
Perfect. And I just thought, definitions wise, again, people who may not be as familiar with direct trust and the ENAC, the commission, there is a criteria council that informs the commission and approves all of our criteria that goes into the accreditations, as well as looking at all of the organizations that come through the accreditation process. So it's part of our whole governance structure. So it's a transparent governance mechanism. So this is a way, it'll be kind of the circular loop. I did not have a graphic put in for that because I just now thought of it. But anyway, it's we inform them, they inform us, yada, yada. But I think we want to have a very collegial, collaborative space. And I think hitting on actually that peer group at the top, I think we had at our direct trust conference just recently, a really awesome CISO panel, or it wasn't the panel, it was a CISO roundtable that was closed door.
Yeah.
Very, no media, no phones, like an opportunity for folks to have an open discussion about what's working, what's not working. So we would like to see that kind of continue here as well, and have a comfortable space that we're not here to compete. We're not here to show each other's weaknesses. We want to see how we can all do better.
Well said.
Thank you. Oh, that's interesting. That is not what I expected to see there. Oh, I forgot it comes in. Oh, the PowerPoint's so incredible, isn't it? How it does things. Wait, there's more. Wow, first day with
We're all
PowerPoint.
laughing with you.
Thank you.
We've all been there.
I'm like, oh my gosh, what's happening right now? It is
doing
because
great.
our marketing team is so stellar that they put all this in for me, and could totally run circles around me on anything with graphics and presentations. So props to them. Anyway, this is what's happening right now. So we really started kicking this off in September, getting some awareness, had some great meetups at our conference. I did a little, of this at the Civitas conference that happened last week. We're here right now at the information session. Mike's working on a co-chair. We think that's happening. I'll follow up on that. And then we want to have a kickoff call in November. So once we know kind of who all is like, yeah, I want to do this, I will, we have a couple tentative dates looked at, but I'll work with everyone to see if we can get a critical mass time that's agreeable. And then we will be drafting a charter of let's get moving. We want to work right away. That's why we're here. We are not Congress. We are going to move. So, and then finalize a charter and like, let's talk about what 2025 looks like by the end of the year. So pretty straightforward. So get involved. So I'm going to put a link in the chat. A few people have done this link already. Link where you can, it's a real easy, like, 5-field form of just let me know that you are really interested in participating. And then that puts you in we'll have it tracked in our project management system, and I will know who I'm working with and who to follow up with. And we'll reach out to you with that next step. This is a good place for me to also just make sure everyone knows that our work groups are actually a benefit of Direct Trust membership and participation. I don't think explicitly say it when I was introducing us, but we are a 501(c)(6). We're a member organization. And so we do have membership and bylaws, and work groups are part of membership within our bylaws. So I will, if you're interested, follow up with you about that. And also, if you want to know more about what membership looks like, I will put the link here. And for those, I think I have people on the call, several people who are already members from a variety of types of organizations and even individuals who can attest to that. I feel our membership participation dues are pretty reasonable, especially even for an individual level. So we hope that's not a deterrent, because we really want to have you participate with this group. The more diversity of healthcare voices we have, diversity of perspective from the industry, from technology, from on the ground, we would love that.
Absolutely.
So, anything else there? Just get excited.
Yeah, we're really looking forward. We've had a lot of conversations about starting this over the last couple of months, and I've got to say, as we talked to some of you, as we've talked internally, I think we're all quite excited about not to usurp a phrase, but a more direct action, or a more direct action arm, a fast moving. Sort of tackling issues on the ground and providing real time or near real time, as fast as you can, sort of solutions to the industry. I think this is something that is going to be a lot of fun for those that join. Quite frankly, I think it's going to be an interesting ride. So we're looking forward to all of you joining.
Yeah, and we will, I think most of the people on this call I'm connected with on LinkedIn. We are really good at promoting you on top of it. So if you're doing something cool, like we're all going to lift each other up. There are so many advantages for how we can demonstrate all of our own visibility, credibility within this opportunity as well. And as my dog's wandering around here, he may pop up at any time. So another thing, in benefit of some of our meetings, you may get animals, you may get all kinds of, randomness, but that's the beauty of remote meetings. Are there I don't see anything in the chat. Feel free, this is not a huge group on this call. If you want to come off mute, and anyone have any questions or anything we can answer, or just. Or any of our members want to tell us, chime in on what you're hoping to see too?
Well, Susan, I don't think my organization is a member, but I am very happy with what you're doing here. I think it's fantastic that this is being addressed, and I look forward to helping in any way I can. And I'm going to investigate within Microsoft whether or not we can become members and join in this effort.
Thank you. And thank you for, you were at our conference too, and that was a huge contribution. So we really
Thank you.
appreciate
Much
that.
appreciated.
Yes. Any other questions? Otherwise, this could be your favorite meeting of the day because it would be a lot less time than you were scheduled for. And don't tell anyone you're not on a call and you can get something done. Okay, well, I won't hold you hostage, so we can end as soon as I find, the buttons to do it, because it's hard when you're presenting. But go ahead. I look forward to and I will send the recording back out if there's something you missed or if someone you want to share it with, if there's a more appropriate person at your organization. So we'll be doing that. And thank you, Patrick, Indiana friends. Right. Okay.
Thank
Well,
you.
Thank you, everybody.
Be in touch soon.
Have a good
Thank you.
weekend.
Take care.